Today we're going to be talking about the head. Some of the objectives for this lesson are we will be discussing the elements of an accurate health history of the head, eye, ears, nose, mouth, and throat. We will be describing the physical examination techniques performed to evaluate the eye. We will be identifying the measures for prevention or early detection of eye diseases, infections, or vision loss. We will be describing the physical examination techniques used to evaluate the ear, nose, mouth, and throat. We will be identifying the measures for prevention or early detection of the ear, sinus, and throat infections, hearing loss, changes in balance, and the maintenance of oral health. We will also be performing an assessment of the head and face using proper techniques. As for the skull and face, it should be smooth to palpation with no unusual contours or bulges. Contour abnormalities, bulging, or tenderness result from trauma, congenital anomalies, or surgery. So go ahead and palpate your own head. If you want to palpate maybe someone else's head, maybe someone from your family, a friend, that's fine. Irregular jaw movement or cracking of the jaw may indicate TMJ syndrome, which TMJ is your temporomandibular joint. So go ahead and watch this video that I provided here for you, and you will be able to hear the cracking noise, and that's usually not a normal sound to hear. So if you want to go ahead and palpate your own TMJ, or again, maybe someone in your family, a friend, you can go ahead and practice. When examining the eyes, you will inspect and palpate the external eye structures like the eyelid, lashes, sclera, conjunctiva, lens, cornea, and pupils, as well as the internal eye structures. And finally, you will assess the vision, like the acuity, the distance, the nearness, the color, and the visual fields. So there should be no pallor, no dryness, or edema in any part of the eye. Vision loss is a significant public health issue that affects millions of people and can greatly impact the quality of life and independence. One of the biggest challenges is that many serious eye diseases such as glaucoma, cataracts, age-related macular degeneration, and diabetic retinopathy often develop without noticeable symptoms in their early stages. As a result, individuals may not realize there is a problem until vision loss has already occurred. Because of this, regular comprehensive dilated eye exams are critical. These exams allow eye care professionals to detect diseases early, even before symptoms appear. Early detection significantly improves the chances of successful treatment and can prevent or delay blindness in many cases. In addition to routine exams, healthy lifestyle choices play an important role in protecting vision. This includes maintaining a balanced diet, managing chronic conditions like diabetes, avoiding smoking, and protecting the eyes from UV light and injury. As for the ears and hearing, you will assess the external, middle, and inner ear, which would be the tympanic membrane. If you didn't know, the tympanic membrane is the eardrum. You will also assess hearing through the Weber's or Rhine's test, as well as balance through the Romberg's test. So with the Weber's test, I did provide a video as well with the Rhine and the Romberg's test, so you can go ahead and watch those videos. The Weber's test is basically placing a vibrating tuning fork on the center of the client's head. The client should be able to sense the vibration equally in both ears. You want to record a positive Weber's test if the vibration is louder in one ear. As for the Rhine's test, if the Weber's test is positive, you will need to perform the Rhine's test to assess the type of hearing problem. The Rhines test also uses a tuning fork to compare air conduction and bone conduction. Normally, air conduction is twice as long as bone conduction. So you can go ahead and click on that video at the top to go ahead and listen or get a better understanding of how both tests are performed. As for the Romberg's test, the client should be able to stand with their feet together and eyes closed and maintain balance with minimal swaying. So swaying and moving would indicate a positive Romberg's test, which could indicate a vestibular or cerebellar disorder. So on the left bottom, that is a normal Romberg's test, and on the right bottom is an abnormal Romberg's test. So you can go ahead and watch those. As for the nose, you will assess cranial nerve 1, which is the olfactory nerve, through the sense of smell. The sense of smell diminishes in older adults because of a gradual decrease in and atrophy of the olfactory nerve fibers. When assessing the mouth, the lips, buccal mucosa, which is the mucous membrane of the cheeks, the inner cheeks, and gums should be smooth, moist, and pink in color. Increased pigmentation, for example, bluish or dark patches, occurs in dark-skinned clients. No lesion should be present. When inspecting the mouth, carefully examine all aspects of the tongue, so that would include the dorsal, the ventral, and the lateral areas of the tongue. So in the first picture, I did label the dorsal, which is just the front of the tongue, the lateral, which is the sides of the tongue, and the ventral on the bottom picture would be the underside of the tongue. The tongue should be moist, symmetrical, slightly rough, smooth, pink, and freely movable. The hard palate, soft palate, and oral pharynx should be pink, moist, and intact. No lesion, swelling, erythema, or discharge should be present. Preventing infections of the ear, sinuses, and throat begins with basic hygiene practices such as frequent hand washing, avoiding close contact with sick individuals, and staying up to date on vaccinations like the flu shot. So managing allergies and avoiding environmental irritants such as smoke can also reduce the risk of sinus and throat infections. Early detection is essential. Individuals should pay attention to symptoms such as ear pain, pressure, sinus congestion, sore throat, persistent cough, or fever. Seeking medical care early can prevent complications and allow for more effective treatment. Hearing loss prevention includes protecting ears from loud noises by using earplugs or noise-canceling devices, and limiting exposure to high-volume sounds. Regular hearing screenings help detect early changes, especially for those exposed to loud environments or aging populations. Changes in balance may be linked to inner ear problems. Warning signs include dizziness, vertigo, or unsteadiness. Early evaluation by a healthcare provider can help identify underlying causes and prevent falls or further complications. Maintaining oral health involves brushing teeth twice a day with fluoride toothpaste, flossing daily, eating a balanced diet low in sugar, and visiting a dentist regularly for cleanings and exams. Early signs of oral health issues include bleeding gums, tooth pain, or sores that do not heal. Preventative care reduces the risk of cavities, gum disease, and systemic health problems. So this is a video demonstrating probably most of your procedures from your chapter. If you start at 3:30 and watch until 14:13, you should get a well-rounded explanation of how to perform each procedure. You want to get familiar with the cranial nerves and start trying to memorize them, because they will be helpful for you to use throughout your entire nursing program.